My name's Crystal, and I want to look like Britney Spears. I kind of have a boyish figure, and I wish I was a little more endowed. I have a pretty flat waist like Britney, but I definitely need to work on the breasts because, see, this just doesn't look right. I don't look right in these kind of tops. I think she has a really cute nose. I think mine's a little too pointy. I want a rhinoplasty. She has the more plump cheeks, so I'd like to get fat grafts on my cheeks. And also she has a lot fuller lips. I want that whole, full lip look. I want to get lip injections. For breast size, I really need to work on that also. I want breast implants. Just give me that extra boost that I need, for that real person that's inside of me, just to be able to come out. I'm going to get my consultation with Dr. Ackerman, my plastic surgeon, and my boss. Hi.
Hi. How you doing?
Good.
Tell me what you have on your mind.
I'd like to get my nose, fat graft in my cheeks, lip injections, and my breast to look more like Britney Spears. I have a couple photos to show you.
Well, I cannot make you look exactly like this photo, but I will look at specific anatomical proportions and see how that might fit into your anatomy. You definitely have a dorsal hump, so we do need to lift the tip up. Doing a little bit of fat grafting, you'd have more of that smiley look all the time, slightly fuller like so, give you more of a fuller, sensuous lips.
I want this whole look. I just want to have about a D cup.
The incision ought to go right below the areola, partially behind the muscle, so I think we can create this look for you.
Okay. It's pretty exciting. But I will look like Britney. Today's my day of surgery. I'm going in a couple hours. Day 15, gotta go. My biggest worry is anesthesia. What if you don't wake up? Oh, my tummy. Oh.
A little nervous? No, a little nervous. Okay, you can do fine.
I got fat grafts in my cheeks, a nose job, lip injections, and breast implants. I think I look more like Britney Spears. I'm happy with my results.
An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
Dr. Ackerman, thanks for allowing our cameras here.
Thanks for coming in and see us.
The fast track facelift.
That's correct. It's a wonderful procedure. In essence, we're trying to achieve wonderful, lasting, deep results. By deep results, I'm referring to fixing the foundation, correcting the deep structures, and yet, instead of waiting weeks and weeks for recovery, which typically would take, get patients back up in circulation within a week.
Is this a younger group of patients?
Not necessarily, although we're seeing many, many younger patients coming in for their first facelift, and it is a facelift in a sense. Patients in their 40s don't want to look 40 anymore. They want to look maybe late 30s.
Can you do that?
Oh, absolutely. We can take a 45-year-old woman, perform this procedure, and have her look in her 30s. Okay. And yet, nobody will guess she's had surgery. She'll just going to look very nice, young, refreshed, and rejuvenated.
Now, most people know you in Newport Beach. Talk to people, they know that you're the go-to guy for a natural-looking facelift. Ivy League trained. Impressive background.
Background's very important, but it's not all, of course. You can train in the best places, but you have to have the skills, the talent, the technique, the artistic vision to create specifically what one is trying to achieve.
Now, when I walked in here today, when I hear about fast track facelifts,
yes,
respectfully, seems very gimmicky.
Well, I had to name this procedure something. It really refers to that our patients are able to return to normal activity within a week.
And still go deep.
And still create the significant changes that I truly believe facelift surgery needs to create. If you don't do the deep changes, you really are shortchanging your patient,
Okay,
I believe.
so nationwide, not all surgeons are addressing the underlying tissues. Or they're not aggressive enough?
Ultimately, it's if the surgeon clearly explains to the patient what they're getting, if the patient's saying, that's okay, that's good enough for me, then it's fine. My philosophy, I get patients back in circulation within a week. Why not give them the best procedure that's available? best procedure to create vibrant, youthful look, vibrant, pretty face that lasts for many, many years.
So people throw around artist nowadays when it comes to the facelift, et cetera. But I mean, you really see yourself as an artist, and your patients. I've talked to your patients, and if you look at your work, and I'm careful not to endorse guys on my show. I'm just asking the questions, but your work is good. It's
Thank
natural.
you.
It doesn't have the Newport Beach. Everybody says Newport Beach. That done look.
So it is an artistry, and yet it's very unique artistry. Skills involved, artistry involved, visions involved, and then ultimately to execute all that to create beautiful, significant, and yet natural results.
What should somebody look for in a surgeon that's going to, especially deal with the face?
Well, I think the body of work is the most important. You can have someone that's well-trained, even board certified, and yet you ought to look as a patient.
Look at their work.
Look at their work. Absolutely. We all stand on our results.
I mean, you have high volume of before and afters here. I mean, it's a lot of us. It's not just a few.
Well, I've been in practice for many, many years. We have thousands of happy patients, so a wealth of clinical data that I can choose and pick. So we do have a number of very happy patients.
Okay, the hot new lift. You're calling it a fast track lift. What is that?
Well, typically a facelift, if it's done well, namely you create deep foundational changes, would take many weeks to recover. There are a number of lesser procedures available. In my view, those lesser procedures typically create lesser results.
Less results.
You might look a little better for a few months and then you look about the same. I believe to create beautiful results, you have to do foundational work.
Tell me about that foundational work. Deep.
Basic.
What does that mean to you? What is deep?
Deep implies that a surgeon analyzes patient's anatomy now and envisions what the anatomy was like 10 years ago, 15 years ago. By anatomy, I mean, where's the cheek position? Where's the jawline? Where's the neck? Where's the deep structure? And in surgery, I reposition those structures to really create the young face. Not just tight face, but young face.
I spoke to one of your patients and I said, is this you? 1 week later. She said 5 days.
For most of our patients that have just fast-track facelift, they're back in circulation within a week. With some
Is this
makeup,
your lift? I
within
mean,
a
you
week.
came up with this? I mean, this is your design.
I put a number of things together. Ability to do the deep work with decreased trauma to the tissue, preoperative preparation, getting patients in and out of surgery fast, including doing some of these procedures under local anesthesia with sedation,
Okay.
and then getting them back to work within a week.
What's the age range for the fast track?
Well, the wonderful thing about this procedure is that it lends itself very, very nicely to someone in their 40s, whether early 40s, mid or late 40s, somebody that truly has only a week off work, and yet they want to come back looking a decade or so younger. Anyone in their 50s or 60s, likewise, can create significant change, even if somebody has significant signs of aging. And of course, this procedure lends itself for somebody a bit older that might not want to have general anesthesia and yet is willing to go through procedure where they can look a decade or two younger.
So what signs of aging does this address the most?
This addresses the typical signs of aging we see in anyone, whatever decade, 40s, 50s, or 60s, namely loosening of tissues along the jawline, the proverbial jowl, and that's really descent of tissue along the jawline. The whole cheek descends so that you have more of a hollow cheek.
So these two folds, does it take care of that?
Well, absolutely. The fold is just a symptom of a disease, if you will. The fold is caused by the cheeks sliding over. So you need to reposition the entire cheek, not enough to remove a little bit of skin. And of course, the neck. That neck always gives our age away. So if somebody has fullness, loose tissues, and that includes skin, fat, and of course the foundational muscle, all that can be fixed with this procedure. Marla came to see us because she wanted to improve appearance for her face. Of course, on examination, you can see a very pretty, well-balanced face. Nevertheless, there were certain signs of aging that we all exhibit at a certain time. There was more jowling, the cheek was settled down a bit. So I came up with a wonderful plan for her. There's a wonderful new procedure that I do called Fast Track Facelift. That's what this was. That's exactly what it was. It's a procedure where I can create significant foundational changes. To create a beautiful, balanced, long-lasting result, you have to fix the foundation of aging. Typically, when you create those changes, there's significant healing time involved. Many patients are not willing or not able to take that much time off work or typical social calendar. I came up with a procedure where I create significant changes. I do all the foundational work, and yet most of our patients are able to return back to work within a week.
Yeah, look at these photos, and this was a week later, Marla?
Yes. Oh, actually, it was 6 days later.
I mean, you have a huge difference in the jowl area, the neck, very clean. Now, why did you choose Dr. Ackerman? How did you hear about him?
I happened to be at a luncheon. I was covering a luncheon, and there was this woman there who was about 10 years older than me, and she just looked marvelous. And we got to talking, and I told her that she looked marvelous, and she just looked at me and she said, "Thank you, but I've had a facelift." So I said, "Who?" You know, of course.
Yeah.
And Boris Ackerman. So that was it. That was it.
Did everyone at the table
Oh, it just
decide to go to see Dr. Ackerman?
It got us into a girl talk that I've never had with women before about plastic surgery.
You look great for your age. I
thank
know your
you.
age.
Thank you.
You look 10 years younger.
Thank you very much. And that's good. I like that.
Now, Dr. Ackerman, is that the goal? I mean,
That is the goal. The goal is for people not to guess that our patients had a facelift.
Yeah.
The goal is for observers to be very wrong about our patient's age. So you create a beautiful foundational change so this patient looks like she did 10, 15 years ago.
she told me off camera, she said that it even frustrated her that the great facelifts go unnoticed. Do you feel the same way?
I personally don't feel frustrated whatsoever. That is my goal. The goal is to create a beautiful, significant changes, but in a very natural way.
Denise Murray and Jerry Wynn live in the high desert of Southern California. And when they met 2 years ago, it was love at first sight.
We met through mutual friends, and as soon as I met her, it was electrifying. I mean, she swept me off my feet.
I knew when I saw him, the moment I saw him, I even told my mom, I called my mom on the phone, I go, I had just met the man of my dreams. I knew it right then, and I never thought that existed. I never had ever seen anybody else on this earth that I went, oh, he did it.
Jerry proposed.
Try this one?
Oh, I love this ring.
Yeah, that's nice.
Perfect.
And today, their marriage plans are in full swing,
I like this one.
Okay.
with preparations that will also include some permanent physical alterations. Plastic surgeon Boris Ackerman will help get them to the altar in style.
How you doing? Okay, well, let's talk about your bit of an angry look as you described that. You have relatively low forehead, and the eyebrows have descended down quite a bit. Your muscles in this area are quite hypertrophied, thickened, and they give you more of an angry, tired look.
Yeah.
There's a wonderful procedure to correct that. It's called endoscopic brow lift. You have a typical traumatic laceration of your upper lip. You have what's called a step-off effect. At this incision, it steps off and it runs lower. So after we recut this scar, we'll match it up and line it up evenly. Finally, let's take a look at your nose. Certain strong features of your nose need to be preserved. As you look at your face, you have just a bit of a hump. That barely needs to be shaved. The tip of the nose comes out forward. You just need to set this tip back closer to your face so it doesn't have that over-projecting look. Okay, Denise, it's your turn. Well, I do see some darkening around your lower lids. In your particular case, you do have a true pigment, a little bit of excess pigment in here. Other than that, you don't have any fat, no real extra skin. Overall, you have beginnings of a very, very nice nose. I can see exactly what's been troubling you for many years. A very specific anatomy in your particular case. There are specific cartilages in the nasal tip that are configured in such a way in you that the division between the two is very, very noticeable. Next step, I'll have you both change into the gowns. All right, well, you do have moderate amount of fat on top of your muscles. Your skin tone's all right, so you should be able to handle liposuction quite nicely. Very good. It'll be your turn next.
Okay.
Let's take a look at you. Go ahead and sit up real straight. Let's take your gown completely off.
Okay.
Arms out. I know it's not a very comfortable position, but this is sit up real straight, back real straight.
I have had 2 children. I breastfed both of them,
Right.
and so I know that they are not the same. They have some sagginess to them. Also, the areolas are pretty enlarged, and
Right.
I hate that. I want
Right.
them to be smaller.
Of course.
And I just want them to be like they were when I was younger.
We'll be doing breast lift surgery and breast augmentation surgery with an implant at the same time.
Plastic surgery. The idea of having plastic surgery before a wedding, I wouldn't call it normal. I'd call it California.
In all, the bride and groom will undergo a total of 11 procedures. For Jerry, endoscopic brow lift, rhinoplasty, scar revision and fat injections, followed by liposuction of the neck and torso. For Denise, breast lift and augmentation, followed by rhinoplasty, laser resurfacing and lip augmentation. Jerry is first up for surgery.
Jerry, we're ready. I'll be here when you're done.
Okay, I hope so.
I will. Right here.
Run away on me now.
2 weeks later, she's heading into the OR herself.
Can you do...
Playing nurse to Jerry for 2 weeks hasn't deterred Denise's love.
I want to marry him very much. He is the love of my life.
Dr. Ackerman has good news for Jerry out in the waiting room.
She did wonderful. She did very good. We set out to do a number of things. Everything was just perfect.
Thank you.
I love how everything turned out. My nose, out of everything else, that is my favorite thing because it is perfect, perfect. And I got the biggest compliment as someone told me, oh, your nose isn't the first thing I look at anymore. My breasts are perfect. I mean, they're not too big, they're soft. The best thing is Jerry thinks they look perfect.
People didn't even know that I had the nose job or anything like that. They said, everyone just said I just looked really well rested. I liked everything. I was very pleased with everything, but I'd have to say my favorite thing was the scar revision. It had bugged me, and it didn't bug anyone else. It just bugged me. I got motivated, and I lost some weight too. You know, in conjunction with the lipo, I lost like 30, 35 pounds almost in 40 days. You know, you knock 7, 8 years off your appearance. It does bolster the spirit of a champion, definitely.
It's never easy to choose the perfect gift, but more than a few of your eyebrows may go up when you hear what one California father got his little girl for graduation. New breasts. Yep, you heard me right. April Woodard has the story.
This 18-year-old didn't get a fancy car or an extravagant trip as a graduation gift. Her dad got her something much more unusual: breast implants.
It's a big part of being a girl, you know, and when you don't have them, it's a hard thing.
She's a dancer from the OC, California's Orange County, who wants to be a LA Lakers cheerleader.
I love dancing, I love performing, and I think when I have the surgery that it's going to help my chances as making like a girl.
Cassandra Olsen is sick of wearing special push-up bras, so she asked her dad, Kermit Olsen, for her unique graduation gift.
She's not after Playboy bunny breasts. I mean, she's just after enough to, like you said, fill out a prom dress or fill out a bathing suit.
Her friends think it's great.
Oh, she's gorgeous, yeah. This just adds to it. She's already a 10. It's going to make her, honestly, a 20.
It's definitely a different gift. For Cassandra, I think it's perfect. She's wanted this for a long time.
So today's the day we accompanied Cassandra and her dad to the doctor's office.
Good morning.
Good morning.
Cassandra did great.
Wonderful.
As for Cassandra, this is her before and after. She went from a bra size 32B to 32C. She told us she put a lot of thought into getting breast implants and is thrilled with the results, even though they're not permanent.
The doctor had said to me that basically every 10 to 15 years I'm going to have to do the surgery again. And I mean, it's not the best news, you know, but I mean, it's worth it to me.
Marie Taylor has never considered herself beautiful. Instead, she's relied on her inner qualities. And until recently, that was enough. She found love and planned to marry a man she had known for over a decade.
Walter thought I looked good. Like always, I think I need to lose weight, and he would tell me, you're crazy. He loved me, you know, he was okay with the way I looked.
Marie decided to have a makeover, but her savings only afforded enough for a tummy tuck and breast lift. Then, on the way to her surgery, she took a detour at a desert casino, where chance struck again.
I started playing slot machines, and I was down about $700. And at one point, I got down to where I only had one credit left, but I won $250 on that spin. And then before that $250 was gone, I hit the progressive for $213,000. And it was amazing. I still can't believe that it happened.
She turns to Dr. Boris Ackerman to complete her makeover.
How you doing? Okay, how are you? Overall, you have a couple of features that are pretty evident. You have very long and narrow face. The nose is slightly over-projecting, slightly large for your face, and gives you that focal appearance and creates more of that severe look. If we were to create a significant scoop in your nose and turn it up, it would be quite odd in your face, in your facial features. To reconfigure this face into youthfulness, we need to make sure that the cheek and lower lid, they flow naturally into each other. That's what young face looks like. So it's not just a matter of doing lower lids and doing the cheek, it's making sure the cheek and lower lid, we call it the proverbial mid-facelift, flows into each other. And that's what young face looks like. In regards to your chin, we can see that your chin is prominent in this dimension, but in the profile, it's slightly retruded. Since we cannot really shorten your face like so, I would create different lines in your profile by putting a tiny little chin implant, very specific type of appearance, just like so. And that really would soften your appearance, kind of feminize a bit of that look, without over-projecting on the side so much. Otherwise, it would make your chin heavy, and that's not what we want. What we want to do to feminize your face, create more of a triangular, more of a heart-shaped type of appearance.
Dr. Ackerman will restore and feminize Marie's face with a total of 6 procedures: eye surgery, endoscopic brow lift, chin implant, facelift, rhinoplasty, and Restylane injections to reduce fine lines caused by aging.
Hi, Stephanie.
You doing makeup? There you go.
Today, her prettier looks have helped to mend her broken heart.
I think it's taken maybe 15 years off my appearance. My favorite part of it is that I look more feminine. It's not any particular feature because it all works together. I like my profile because I never did like my profile before. When I'm in social situations, I'm more open and, you know, I'll talk to people that I don't know, whereas before I wouldn't even talk to the cashier in the grocery store. If Walter saw me now, he'd be thrilled because I do look a lot better than I did before. I mean, he loved me the way I was, but I think he would love me even more the way I am now. I'm glad I did it, definitely.
34-year-old Rebecca Boswell maintains a lively household.
Are you hungry?
With 3 young boys, there's never a dull moment.
Mom, this is the best sandwich I ever had.
For the past 8 years, she's focused on balancing the needs of her family while hiding a severe physical imbalance of her own.
I would say the right breast is, I think I'm in a double D now, and the left side is probably a good A. So it's quite a drastic difference.
Hoping to at last bring some balance to her life, Rebecca meets with Dr. Boris Ackerman.
Hello, Rebecca. How you doing?
Good. How are you?
Very well, thanks. I'm Dr. Ackerman.
Nice to meet you.
Well, let me go ahead and examine you.
Okay.
Go ahead and take your gown off so I can see your shoulders, your rib cage. Slip your arms all the way out. Look right above my head, and like so. Very good. Well, I can see that you have a bit of an implant in here.
Yes.
And you do have a small amount of breast tissue that has slid off the implant, a little bit of a droopy side.
Okay.
This is obviously a completely different story. It's like 2 different people. You
Right.
have a true large, what we call macromastia, very large droopy breast. Obviously, each breast needs a different approach.
Right.
So on the left side, I have to revise the breast augmentation portion. And then, of course, where the large challenge comes in, I have to match the right side to look like the left side.
Rebecca arrives for her long-awaited surgery.
I want them to be as pretty as they can, you know, without clothes on, but with clothes on, I just want it to be like everybody else, you know, just normal.
Okay, Rebecca, you all set?
All set.
All right, my dear.
For 20 years, she's been concealing her body, but today, Rebecca has something to reveal.
I was really pleased right off the bat, and it made a huge difference. And each day they've gotten, you know, better and better. I was real happy with the size too. I think it fits my body frame. It looks proportionate, so that's what I was hoping for there.
Since the surgery, she's gone shopping for clothes, for bathing suits, things she's never worn before she's now wearing, which is awesome.
In the bathing suit, I feel much more comfortable, and I think a lot more confident. It's like a weight lifted, because I feel like totally normal now, like a normal girl. It's neat, because I've never had that since I was in high school.
He knew he needed a drastic change when his obesity became life-threatening.
The doctor told me, if you don't lose some weight, by the time you're 40, you're really looking at a heart attack. Then I really started to realize, wow, like, you know, this could be like really serious. I need to like lose some weight.
Patrick decided gastric bypass surgery was his best option. The procedure permanently reduced the size of his stomach and forced him to change his eating habits. But beneath his clothes, Patrick is hiding an ugly secret.
There's so much skin that it's never gonna go away. No matter how much you work out, how much you run, how much you lift weights, the skin's there, and the only way it can be taken off is just to be removed by plastic surgery.
A month and a half ago, Patrick began a two-step procedure to remove all the excess skin. First, he had a lower body tuck.
They basically cut me all the way around and pulled everything from my waist down up and everything from my waist up down, and it made it all tight, took off all the excess skin.
Now he's eager to continue with his chest and thighs.
To be honest, I just thought that, you know, plastic surgery was something that was vain. But if you look in the mirror every day and you're not happy about something, you know, if it's gonna change your whole self-esteem and your confidence just by, you know, having it, like, what's money when it comes to that? Like, it's your life and your happiness and your self-esteem.
Patrick returns to Dr. Boris Ackerman, who performed his previous surgery.
Hey, Patrick, how you doing?
Good, how are you?
Good to see you.
Too.
Been feeling good?
Yeah.
Well, I think it's been about a month since our procedure.
I'm very excited and happy with my results from my lower body lift, and I'm just looking forward to, you know, going the next step and having my legs and my chest done.
Wonderful. Well, let's see what you look like. Stand up right here for me, please. Let's go ahead and take your gown off. Well, your abdomen looks great. I think you're healing wonderful. The scars, I know, will be pretty red still, but they're not too bad. They're not raised, they're not spread.
Okay.
But the contour is remarkable. Okay, well, let's talk about our next stage. You have significant amount of skin looseness in your inner thigh that extends quite a bit down. We'll be able to correct most of it, if not all. You still have a bit of excess skin around your knees. We'll be able to thin that down with liposuction procedure. Then all this extra skin will be excised.
Another part that really bothers me is my chest. I feel that it's still very loose and saggy in here.
The excess tissue on Patrick's chest is a condition known as gynecomastia.
In Patrick's case, the gynecomastia was caused by two factors, namely excess fat and true glandular tissue. The glandular tissue we find in male gynecomastia is nearly identical to the glandular tissue we find in the female breast. Anatomically, they're almost one and the same. Here, the approach would be to do liposuction in this area, and then through tiny little incision below your areola, below the pigmented part, I will go in and excise the firm glandular tissue that you have right now, and that will significantly improve the contour of your chest.
I'm definitely excited to have this done.
Great.
The day of Patrick's second and final surgery is here. He's led into the operating room while Dr. Ackerman scrubs in.
Patrick has been put to sleep. He's under general anesthesia. He has been prepped and draped, and we're ready to go.
The change in my legs is just huge. There's just all this skin that's just gone, and now like I can move around freely. And hey.
What up, Joe?
Before, when I had all the excess tissue and skin around my chest, I just felt very self-conscious. And so after having the gynecomastia, I feel that I can walk around, take my shirt off, and not have anything stopping me. I finally feel that I've come to the end of the road on being overweight and having all this excess skin. I can just start living my life and making memories in my new body and my new skin.
"30-year-old Jonathan Wynn works as a manager for a credit card company, but his real passion and longtime hobby is digital photography.
One thing about being the photographer is that you don't have to be in the pictures because you're taking them. So generally I'll take pictures of, flowers or something in the grass, but it's something that you wouldn't even notice if you walked by. When you look at pictures of yourself, there's always one thing you go to, first and foremost, and I think that was always my nose. I never felt ugly, no, but I always knew I could look better.
Jonathan hopes to realize his full potential by undergoing facial plastic surgery.
The hope is to be in better harmony, my face, my nose, and my chin, and everything to just be a little bit more balanced.
Jonathan, come on back.
Jonathan consults with one of Orange County's most popular plastic surgeons, Dr. Boris Ackerman.
Hi, how you doing?
Good.
Good to see you.
Good to see you too.
Have a seat, have a seat.
Thank you.
Let's chat for a few minutes.
Okay. I guess I want to soften some of my features a little bit more. I definitely want something done on my nose.
Hold this mirror right in front of you. Before considering any surgery, most important thing a surgeon ought to do is study the anatomy. Overall, it's slightly wide in a couple of areas, slightly wide right here in the bony portion, and you have a bit too much cartilage in the nasal tip.
I wanted to make sure that, I see these people go in for, have noses done and they come out with women's noses.
In male, the nose cannot be scooped out too much, cannot be turned up too much, cannot be made too small for the face.
Good.
You have a very specific flattening in this area. We can take a bit of your own fat, instead of putting any foreign body implants, with your own fat, if it's done in a certain way, it will maintain itself there forever. We will go ahead and balance this cheek out a bit so you have more of a rounded look.
Jonathan's complete makeover will consist of a nose job, fat injections, a chin implant, and liposuction under his chin.
He's a fantastic doctor, and he makes you feel very comfortable, and he's very competent, so no fear. I have no fear about the surgery whatsoever.
I think it definitely has made me feel a little bit more confident in my surroundings in Orange County. I definitely feel like I accomplished what I set out to accomplish.
Tony Mack is a successful salesman who travels around the globe and leads an active lifestyle.
I enjoy a lot of sports. I enjoy racing boats. The last time I raced my boat, I ended up turning it upside down at 170 miles an hour. I just enjoy, activities that keep my mind at its bare edge.
And at 56 years old, Tony's boyish, daredevil behavior hasn't slowed down a bit.
I think aging is a frame of mind. I think that if you feel old, it's only because you are acting old. I feel like I'm 25, 30. I just feel like I have a very young spirit.
Tony often spends his Sunday afternoons racing Yamaha sprint cars at 85 miles per hour. After careful deliberation, Tony made the difficult decision to have a facelift. Tony decides on Dr. Boris Ackerman, based in Newport Beach, California.
Come on in. All right. Well, let's see. I understand you have questions about your face. You want to look better and more youthful and things of that nature. Let's take a good look at you. Let me go ahead and tell you a few things about what I think we can do here. Really, you're aging right in this central oval. What we need to do is take this entire complex and redrape it over your bone, just like so. I will treat your cheek in such a way that will give you more fullness in this cheek area. What I see right now is that you have significant frowning effect, a little bit of angry and tired look. So I will correct that with a surgery known as forehead lift.
Where exactly are the incisions going to be?
Let's see, for facial portion, for face and neck, you'll have incision in the hairline. Then I will make an incision in front of your ear and we'll go just inside your ear so that in this area you will not see any visible incision.
It's the morning of the surgery. Tony Mack's transformation is about to begin.
Come on, Tony, we're gonna go to the OR now. Have a seat here. Aw, you're gonna be fine.
Okay, we're all done. He ought to heal very, very nicely. I suspect he'll be very, very happy with his result.
Hey, Tony, you're doing great. Starting to wake up.
The results are absolutely amazing. Well, I want the champagne. My friends don't really know what happened. They just know that I look different. You did something to yourself. You look younger. What happened? So it's been quite pleasant.
It's lasted about 15 years. He looks great.
Tony, you look fabulous.
Oh, you make me blush. Makes me really feel good that I matched up how I felt inside with how I look now on the outside. I think Dr. Ackerman is an artiste. For me, you know, in my workplace, it's like giving me a whole positive new attitude. It's a comforting feeling to know that you look good. Glasses up.
Where's the Tony? You got me.
And for me, it's what I wanted, and I'm glad I went and got it.